Okay, so the first question, I think we somewhat discussed this yesterday. The attachment styles observed by Ainsworth include all except fairly easy, mostly correct answers. Disinhibited. As we discussed, there is anxious avoidant, and anxious resistance is a variation of it. However, fearful avoidant is what we use for disorganized. And then these three come under insecure. Secure is a separate one. So total four. Disinhibited is nowhere there. Right. Okay. The term adolescent egocentrism is associated with Melanie Klein, Winnicott, Ferenczi, or David Elkind. Do we know what else Elkind gave as a theory? We adolescent egocentrism. What is what does it contain within it? What are the other two things within adolescent egocentrism that Elkind spoke about? Personal fable, yes. What is the other one? Imaginary audience, yes, Madhumita. Imaginary audience and personal fable. Um, Another thing that Elkind also gave was the hurried kid syndrome. Do we know what hurried kid syndrome is? There are a lot of studies done on the Indian population as well with this concept. So I would suggest you write these three words around him so that you know these were the things he was famous for. Well, Klein and Winnicott, we are fairly accustomed to what they are. Ferenczi, does anyone know what he is famous for, what he did, what he gave? Sandor Ferenczi, if I am pronouncing that right. Okay, so he is famous for psychoanalysis only, and he gave active therapy. He spoke about like trauma and also about the empathy. So yeah, these are some of the therapist factors, and the therapist variables are something that he focused on. Okay. Which reinforcement schedule is associated with gambling? Yes, correct. Very easy. Variable ratio. The looking glass self theory was proposed by. Do we know what the others gave? What did Mead give? What did Levin give? Rogers, we know what he gave, but like, what did Kurt Lewin give? Field theory. Yes, field theory. I would also recommend you to remember the figure of field theory. There is a particular figure of field theory. Remember that diagram and remember what vectors, what direction it is, and overall what that figure in general is. Do we know what George Mead gave? Symbolic interactionism, correct? Okay, yeah, he also spoke about gestures, he spoke about the social self. So, all of these words can be put around him in order to remember. Okay. The behavioral technique used in EMDR is to desensitize traumatic memories, is most analogous to. Okay, so let's break this down. So we know thought stopping is a pathology and it's thought retardation and it is nowhere related to EMDR, right? Okay. So we'll talk about the three things: flooding, systematic desensitization, and imaginary rehearsal or imagery rehearsal. So EMDR as a form of therapy in itself, which is used for traumatic memories, uses systematic desensitization. So it's a system. There is a hierarchy that forms, and based on that hierarchy, we try to desensitize it, and it progresses from a slight lower to towards a more higher. Higher stimuli. So that is the progression that it takes. However, in flooding, there is no such hierarchy, there's no such progression that happens. So since EMDR is a structured method and is a structured technique, in eye movement desensitization, we use systematic desensitization as a format. Now, imagery rehearsal and flooding usually is more used with ERP or exposure related and with phobia. But with traumatic memories per se, we use systematic desensitization because we want to start slow, gradually build up on it, right? Imagery rehearsal is usually not recommended for traumatic memory. We do imagery rehearsals in if we want to actually start the whole reprocessing information and reprocessing and recoding, but that happens after a very later stage of therapy, and not particularly in this EMDR structural thing. So imagery rehearsal is where they would try to give you an imagery, and they would try to help you reprocess it. And it's sort of a corrective emotional experience format, but which is used in traumatic memories. However, EMDR specifically is based under the mechanism of systematic desensitization. So even though it is close, just try to choose the more right answer than the other. Okay. Social exclusion is likely to activate which brain region? Butterfly tapping comes under systematic desensitization. I think I'm not aware. I will have to read up on that, but you can check it out yourselves. I wouldn't be able to say it for sure. Social exclusion is okay. This is related with neuropsychology. We'll try to see. So social exclusion, what it can come under? It usually comes under social cognition or any form of social understanding. So how to interpret social interactions. So fusiform gyrus, do we know what it caters to mainly? What it does? Fusiform is actually very popular and very um, restricted to one activity that it's famous for. What it does? Face recognition, correct, absolutely. So fusiform gets eliminated from this. Locus coeruleus, do we know what locus coeruleus is involved in? Norepinephrine release, okay. So we are looking at, yes, arousal, exactly. We're looking at arousal. So locus coeruleus is responsible for arousal. It's responsible for more of those activated states. So yeah, this also gets eliminated. Insular and angular gyrus. So you should be confused between these two. They do have some overlapping functions, but angular gyrus is mostly situated in the parietal region, if I'm not wrong, and it is responsible for a lot of spatial recognition. It's responsible for reading and processing a lot of language related understanding, and social cognition is actually consistently in research related with insula. Okay. Conversion therapy is considered an evidence-based treatment, unethical, harmful, recommended first-line intervention, a component of affirmative therapy. Yes, yes, it is unethical and harmful. Um, okay, you can read newer reports on how conversion therapy looks like in India and what is the role of MHPs in it. But yeah, initially, so do try to also look at the difference between um, gender identity disorder versus gender dysphoria, right? And how initially they conceptualize it as gender identity disorder. Now they call it gender dysphoria. When is it dysphoric? When is it not? Please read up on that. And also, I would. So initially, psychiatrists and psychologists used to give this certificate called the gender identity certificate or the gender identity transition certificate, which was important to suggest that you're fit for taking a conversion therapy or transition. So you can read about this as well. Okay. Which test uses age-based norms and deviation IQ? Binet Simon, Weiss, Fechler, or Stanford Binet and Ravens. Interesting. Okay. Okay. So it's a like mostly roughly everyone is answering two or three, right? Now, for this, you need to remember the historical assessment, evolution of assessment, of IQ assessment mainly. Okay, so the first time age-based norms and deviation IQ was used was in Stanford Binet. Stanford Binet obviously came before Wechsler, and Wechsler used Stanford Binet to come up with his own, right? So, and we know that deviation IQ is more famous or more associated in our brain with Wechsler, but Wechsler borrowed it from Stanford Binet. Okay, so just remember that we often make this mistake that we try to say that it's Wechsler, but it's actually Stanford Binet, which was the first one to give age-based norms and deviation IQ. It was properly framed, properly called as deviation IQ and everything in Wechsler. He sort of characterized and structured it pretty well, but it started with Stanford Binet. So, which test uses age-based norms and deviation IQ? First was Stanford Binet, followed based on that Wechsler was made. Okay, so a more right answer than the other. Object permanence typically emerges during reflexive schemes, coordination of secondary circular reactions. This is straight from theory. Primary circular reactions or pre-operational stage. Hmm. For this, you would have to read Piaget's theory thoroughly and write. If you are unable to understand, just write down the ages and write down in what age what develops. And if you want, you even divide that further for yourself, like 6 months to 1 year, 1 year to 1.5. You can do all of that and write the keyword around it. For object permanence, it usually develops towards the transitioning, so towards the first half. So when the secondary circular reactions emerge, it is then when the object permanence is seen. If anyone can even tell me the year, that would be great, but we'll go ahead. Which of the following would be considered egosyntonic? Hmm. Okay. Okay. So, do we understand what syntonicity and dystonicity is? I will very briefly tell you. So, if something that I am doing, which is could be a pathology, could be not, but if something that I'm doing is causing me distress and is causing me disturbance, and I do not want it, it's unpleasurable for me, then it is ego dystonic. It is not sitting right with me, right? And if what I am doing, I'm not realizing it's a pathology and I'm actually enjoying that, and it's a way I cope with life, it's a way that it has come up for me, and I do not mind. There's not disturbance or it's not unpleasurable for me. It's pleasurable for me, and I align with that. So that is ego syntonic. Now tell me that is OCD? Would we have distress in OCD or we would not? Would we have distress in depersonalization or would we not? Right, correct. So only in narcissistic grandiosity we might indulge in it. A narcissistic person might enjoy that. And okay, I will repeat the explanation. So in ego dystonic state or in dystonicity, what really happens is that whatever we are facing, any signs and symptoms or cluster of things that we are facing, we do not find that aligning with ourselves. It is unpleasurable. We do not believe in it, right? We do not believe in it, and we find it distressing. Basically, level of distress is the differentiator. If it causes me distress, it is dystonic, D, distress, dystonic. If it is not causing me distress, it is syntonic, right? Ego syntonic. So narcissistic person will not be distressed by his own grandiosity, right? Yeah, conscious will could be, but like it's kind of debatable. So yeah, I'll not get into that. According to Jung, synchronicity describes causal relationships between mental events. This is straight away taken from a Nimhan's question. Okay. Events connected by meaning without causal link, cognitive dissonance, repression of archetypes. Omkar, we cannot generalize that all psychotic will be syntonic. Some psychotic do not have insight. So they do not even know what the distress, they can still have the distress, but they would have no touch with reality, right? So we have to see usually syntonicity and dystonicity is with respect to neurotic disorders and personality disorders. Okay. So these are the two blocks we look at. Yes. Can you tell me what Jung's synchronicity describes? Yes. Can I get a little more answers on this one? Hmm. Okay. Correct. Events connected by meaning without causal link. Right. Who gave the term infantile autism? Yes. Tanner. Bluers 4A, you should remember. What did Kreplin do? You should remember. What did Cohen give? You should remember. And infantile autism was given by Tanner. In the four-stage creative process, which comes after preparation, we also discussed this yesterday. I think I just mentioned it. Okay. Right. Incubation. Opti- Optimism bias involves overestimating the chances of negative outcomes, underestimating or accurate risk perception, ignoring past experiences. Optimism bias, okay? Okay. So if we are overestimating things, what does that mean? That means that we think there is more likelihood of negative outcomes to come, right? If there is more likelihood of negative to come, how is it optimism? That is pessimistic, right? If we are underestimating that what our risks could be, or we are in a state of denial that okay, it might not be that bad, so that is optimism bias. When even there are objective risks, we tend to believe that those risks are avoidable or won't be there. Okay. A limitation of Kohlberg's theory is ignores gender differences, overemphasis on emotion, lack of behavioral application, too much focus on punishment. What do we think? Hmm. Okay. Ignores gender differences, right? Do we know who challenged Kohlberg's theory? Who was the person who challenged Kohlberg's theory? What was her name? Gilligan, right? Okay. So, what is she? Carol Gilligan gave the. She said that instead of looking at things from justice point of view, where females are more likely because of the social cultural conditioning, they are more likely to look at from the care point of view. So, ethics of care versus ethics of justice. She has written a book on this and she has titled a paper on this, which is called, if I'm not wrong, in another voice or in a different voice. So yeah, this way just try to even remember their books or page, the topic that they challenged and what was the main original paper. These are some extra information that you can keep handy so that just in case they ask in depth, you also know that in another or in different voice. That was her paper. Okay. Okay, so we just discussed this. The locus coeruleus is most associated with. Hmm. Okay. Yes, correct. Sleep-wake regulation. Um, we know what memory consolidation is. We know what visual attention is, which areas might be included in visual attention, memory consolidation, pain perception. So under pain, remember there are two pathways, pathway A and C. If you want, look it up. And you would want to see the gate theory of pain. Okay, just look at that as well. Hmm. Fundamental attribution error differs from actor-observer bias by how do they differ from each other? Hmm. Correct. Sorry. Yeah, applying to others only. The only way they differ from each other is that um, it applies under actor-observer bias. Self is included. However, in fundamental attribution error, only we are talking about others' behavior, not our own. Okay, this shows conceptual clarity. Good that you know it. Receiver operating characteristic curves illustrate. Correct. Trade-off between sensitivity and specificity. Which of the following checks the robustness of publication bias in meta-analysis? Again, a sort of question that NIMHANS might likely ask. They are fond of systematic reviews, meta-analysis, and the newer forms of, cluster of researches and how we are trying to interpret research trends. So yeah, this could be. It's okay if you do not know. It's relatively difficult, but we'll discuss. Just try to give it a shot. If you know, that's really good. Okay, fine. First, let us talk about what we know about publication bias. What is publication bias? Does anyone know? Can you type it for me? Don't even have to know all of it. Just think what publication bias could be. Okay. So publication bias basically means that in journals and in publication industries, it is mostly seen that they are very likely to publish those papers with significant results. Exactly, Pankudi. So they are more likely to publish studies which have significant or positive findings than which have negative or non-significant findings. And that really skews it in one direction. If we are trying to do a meta-analysis, we want to see an overall picture. We want to see a general picture. We want to see a recurrent dominant theme. But we do not get to see that if only one side is included, which is that if only positive outcomes or a positive result or a significant results are included. So in order to check the robustness of publication bias, so in order to check that, how how biased this meta-analysis is, we use fail-safe end model, which was actually given by Rosenthal, and it tries to see that so the larger the fail-safe, the better it is, because that it means that the more so it would require a lot of null and insignificant papers to actually make the current meta-analysis um, nullified or like obsolete. So I would require a lot more papers to consider that obsolete. However, if I have a small fail-safe n ratio or number, that would actually mean that a smaller number would mean that only a small number of paper, yes, n less than 30. Very good. Only a small number of papers would be needed to render this study or to render this meta-analysis as obsolete or non-functional. Okay, or insignificant overall. Rash model deals with item response theory. Funnel plot and forest plot mostly are visual plots that will look at, again, one of them I think looks at publication bias only. The other one I'm not sure. You can look it up. Okay. Okay. The Belmont report includes all of the following principle except interesting. Okay. Hmm. Yes, Ruhi. Even if you do not know about Belmont report in depth, you can try to understand from the ethics point of view. What are the ethical principles that we keep hearing again and again that are important? Beneficence, then non-maleficence, justice, respect, their very righteousness. They respect the dignity of the person. Fidelity, however, do we consider fidelity to be that important or one of the core principles of ethics? Not really. Okay. So yes, try to use elimination even if you do not know. Okay, agraphia, acalculia, finger agnosia, and left-right disorientation constitute. Very good. Do we know what Anton syndrome is? Do we know what Kluver-Bucy is? Do we know what Balance is? No? Okay, fine. Regarding amygdala, okay. Correct. Okay. So out of the four options, you should delete like B and C because Anton's deal with blindness, and Kluver-Bucy is due to the orbitofrontal or due to the hypersexuality or hyperorality that happens. So it's firstly Kluver-Bucy is frontal and Anton syndrome deals with blindness. So these are not the ones. Where would we talk about agnosia, apraxia, all of this? Parietal syndromes, right? So parietal syndromes include Gerstmann and Berlitz. And Gerstmann includes agraphia, acalculia, finger agnosia. Balance actually includes simultagnosia, which basically means not being able to perceive two objects in the visual field at the same time. Okay. Cerebrospinal fluid is primarily absorbed through the mm, yes, arachnoid villi, because choroid plexus. Where would we find choroid? What does choroid? Where is choroid as a layer located? Okay. Okay, fine. Okay. Right, Unnati, very good. Okay, very good. Just think simple, okay? Think simple. It might be located in other places as well, but what are the three layers of the eye? Okay, so choroid plexus are located both in the ventricles, are located in the eye, are these are plexus is a like a junction or accumulation of other nerves. So they mainly are related with providing nutrition, providing blood supply to the eye. Or we have also spoken about the stomach lining where choroid plexus is called. However, I think it's better to associate choroid plexus with eye. And foramen of Lushka, foramens are cavities that would not actually, a fluid would not be absorbed by a cavity. Corpus callosum, we know it connects, so that could not be, so that leaves it. Which with the CSF is a fluid in the brain, right? So it should be absorbed by one of the layers or layers of the brain and layers of the skull. One of which is the middle one is arachnoid, and arachnoid is the one that is responsible for absorbing CSF. Okay. Usually, absorption is done by hair-like structures, villi. So even if you do not know the exact name, go for villi because absorptions are done by villi or hair-like structures present in the linings. Okay. The ratio of true positives to total diagnosed positives in a screening tool is known as. Okay. So there's firstly, it's not specificity because it deals with negative, right? It deals with the negatives. And it's neither NPV because that also deals with negative. So it leaves us with sensitivity and PPV. Now read the question again. Ratio of true positives. Very good, Devrakon. So true positives to total diagnosed positives. So we are not talking about true positives with the total number of whether they are positive or negative, we do not know. True positive with total is sensitivity because we were trying to find out how many of them are actually true positives, right? That is what sensitivity checks. But if we are talking about true positives out of the total diagnosed positives, then that is PPV. Okay, that's the only difference between the two. It's a very important difference to remember. That the denominator, yes, the denominator is actually total diagnosed positives, not the total pool. Okay. Okay, fine. So for example, just let's assume we have to detect COVID, right? We are trying to understand COVID. So we might have so we have been given that there are 100 people who have got themselves tested, and out of which 70 of them are actually diagnosed with COVID, and that is what we are 70 has a positive result in the test, and we want to see that out of those 70 positive in a 100 group of people that we tested, so how many of them are actually true positives and how many are due to error? So if we say that 50 were true positive, so if we are trying to check, if we are trying to get a ratio of 50 by 70, which is the total positives that we got out of 100, then that would be PPV. But if we are trying to see the true positives out of the total number of tests, the people that we tested on, like 50 by 100, then that would be sensitivity. Okay, that's the difference. The population or the group that we are taking from is the difference. In behavior therapy, response cost is an example of, yes, it would be what positive is when we add something, negative is when we remove. If I'm paying a cost something, so I am removing something from myself. I have to pay something, I have to do something about it. So that is negative punishment. Okay. Okay. Multicollinearity affects which aspect of regression analysis? That others try as well. If someone could just tell me what multicollinearity is. Yes, Tanshi. Okay. Suppose I want to generate a theory. Suppose I have some relationship going in my mind, and I take two very similar variables. Like I take variables of say I want to, this is a very arbitrary example, but I am taking variables like that measure anger, and I am taking the other variable that measures frustration. So I would see that both frustration and anger has a lot overlap between them, right? They are very highly correlated variables within them in itself. They both are so highly correlated that we actually do not know if they are adding anything to the study. So it would be a waste to use two very similar variables. If I am using trying to see self-esteem and if you're using self-esteem and self-efficacy, they're very similar in the concept, so they would have high multicollinearity between them. So it's better to actually just use instead self-esteem, because that would eventually be measuring self-efficacy. So why do we need to use two very similar variables when they are actually very highly correlated? And that is the effect of multicollinearity. uh, and it affects the stability of coefficients. Yeah, the effect of the model as a whole won't change. Actually, I think it does change. So what happens is that multicollinearity affects the stability of the coefficients, and because it affects the, how does it affect? So basically, even if I make a small change, or even if there is a small change in data, we might get very mm, like very large jump, or like magnificently drastic changes in the overall analysis that we are doing. So MPhil entrance does not usually ask, but some of, like I mentioned, the private ones do ask about these research concepts and statistics concept in depth. So yeah, I mentioned yesterday that independence of residuals is what we deal with partial correlation. That is where we're trying to see the independence of residuals, right? Intercept estimation does not apply here. Linearity does not apply here. So stability and independence might confuse you. Stability of coefficients means that if I have multicollinearity, so because there are two variables who are actually very highly correlated or similar to each other, so even if I would not be able to tell you that if there is an independent or true relationship between the variables, because they're so similar in each other, I don't know which is causing what and in what extent, because they are so similar, and a true relationship cannot be understood. So the stability, if I change any data, the entire model changes, and that is why it is very unstable or unstable to understand it. Okay. Okay. So yesterday I mentioned that independence of residuals, basically in partial correlation, we want to see that we try to control for the third variable. Okay, so as I mentioned, like we want to see the effects of stress on sleep, but my age could be a third variable, and I want to control that third variable, that is my age. So what I would do is I would try to partially correlate, use partial correlation to see actually that how much of it is because, so that I can minus the residual effect of the third variable that is coming. So I only get between stress and sleep instead of getting the age in the middle. So if we are trying to see the independent residual effect, if we are trying to see the combined effect, for all of these things, partial correlation is something that is used. You can associate that also if you do not want to go into detail, right? But multicollinearity is associated with the stability of the coefficients. Okay, I think that would be all for today. I am open to more questions. I have around 10-13 minutes. So yeah, you can ask me if there is anything. I will meanwhile also check the Q&A if you have sent anything there. If you want to ask me anything else, I hope these MCQs help you see how much you've scored. I keep name dropping things. Just write it down, search it, understand it yourselves. And I'll send resources through Shannon, other papers and everything, so you can solve them as well. Yeah. Just let me know if you have any other question. Uh, where can you find the recorded classes? For that, you can ask the Cogwatch team and they will guide you and help you always. Hi, could you tell us more about what parts we should we focus more on? See, I think the parts that you should focus more on are usually, if see, I've said earlier as well, research stats are usually very heavily and in-depth asked by the private ones. In the government ones, also basic concepts should be clear. So you should be very clear between correlation, partial correlation, all of that. And with an example or with an application-based question, right? So this is how you should understand which parts to focus. There's no such part. Every part is in a way important because they can ask from everywhere. Just make sure, if you cannot do a lot, do less, but just make sure you know the basic ones correct. You know the very basic theories of personality, very basic theories of general psychology, basic theories of social psychology, like fundamental, all of that, the nuances and the depth of that conceptual understanding should be correct. That is all you should know. Just even you can write down that in this chapter this is what is asked more, so this is what I will do. Just make that list if you are just starting out and if you do not have enough time. Okay. Mm, do you have a set syllabus that you use for MPhil? If so, could you pass it on? Uh, yes, Omkar. You can.
Yeah. Hello.
Yes, yes.
First of all, the MCQs is really good. I'm also
Mm,
preparing for my MPhil.
okay.
These MCQs I actually got to know a bit late about
Okay.
this one, so I just joined it as like as soon as possible I could. But
Hmm.
it was really nice. It was a bit complicated. Few questions went above my head, but it's good. I'm knowing
Yeah.
what I am. I don't know, and it will be good if I do mistake here than in the entrance.
Yes, exactly. And even
So
if
my
you,
question, yeah,
yeah, sorry, say.
you're telling. Please complete then.
And even if you do not know them, at least you got familiarized with these terms,
Yeah.
right? It is not a foreign term anymore. So yeah, that's good always.
So my question is like I'm writing few exams, Nimhans and IBAS has still there is no yet confirmation. Will there be an exam?
Hmm.
So if there is an exam for
Hmm.
IBAS,
Hmm.
what should I prepare for that? Is it bit same for
Hmm.
everything or what? Because I'm also keen on getting an IBAS. Like I'll try my best and let's see what happens. But in
Okay.
case I have to prepare in some specific aspect more or
Hmm.
uh,
Hmm.
stats or research or something like that. If you could guide me, it would be really helpful.
Okay. So for EBHAS might release it in September or October. It's usually late than all the other exams, but they will. Secondly, how to prepare for EBHAS? EBHAS is very fond of the history of Indian psychology, history of psychology in India. It's very fond of Yavis patients, who are Yavis patients, all of this, very older psychological forms, if the department is setting the paper, right? If clinical psychology, abnormal psychology would be asked if the department is setting paper. However, sometimes DU also sets the paper. So if DU professors are setting the paper, it would look more in terms of general psychology, factual data, the age range, the year, the name of the person, all of that would be important. And they would be very simple questions. I would see for IBHAS, even the research and stats question that were asked, I was not able to answer. I did not know. And there were around 3 to 4 of them. And I actually was not able to understand because pooled data, all of this, I had not read in depth about. So I tried to solve the ones that were basic and I had read about, and I had whatever I did, I had clarity and grasp over that. And if that question turned up, I did it. And if it did not, I yet managed to get in. So it's not that you have to do research stats in depth to qualify or crack any exam. That is not what I'm saying for any topic, right? You should just know the basic ones, the frequent ones, the recurrent ones. The portion is very vast. You have to put limitations yourself. Limit what you can know because you cannot know everything and you cannot go into the rabbit hole or depth of every concept. So I would not recommend that. Even if you only know the basic about it, but you know the basic very clear, very nuanced, that if someone just gets up and asks you explain this to me, you will explain every part of it. But know the basic really well. That is what I would suggest. And even if you do not know the complex parts or higher advanced of it, that's okay. Leave it. There are other questions where you might score.
Thank you. It was really informative.
Okay. Anything else? Anyone else? I'm here for another 5 minutes and you can ask me. It was lovely interacting with you all and solving MCQs. I hope it helps you and you got to understand some things. And there were any last moment advice for NIMHANS? Hmm. Okay. So, firstly, try to emotionally regulate yourself. It's a very stressful exam. The stakes are very high, and everyone will and the sheer number of people applying for it can actually stress you out in the exam day. So have little rituals for yourself to soothe yourselves on the exam day, and just understand that at the end of the day it is an exam, and just go there to have fun, to enjoy. Do not pressurize yourself that there's such high stakes, and I really, if not NIMHANS, then nothing else. And oh my god, NIMHANS is the best place. um, it is a good place, but it is not the only place. And MPhil is a rigorous degree. If you want to do it, you can do it. And it just provides you license as much as any other place. So try to de-idolize it. Okay. And prepare yourself in a very detached way, as I mentioned earlier. These try to stress regulate yourself. Memory, everything will be intact. Your brain is a lot more helpful than you know about it. Just do not let stress or anything other lower the performance of what you know. Okay, that is the advice I would give. Last minute, and less is more. Less is always more. You do not have to do a lot to get in. Okay, Aparna, yes, ask. You're welcome, Daya. Yeah. So you are getting so much new information, right? Write, just as I've mentioned, take a paper and write the new names that you're getting, and just write one keyword or one line out, beside it. Do not depth read anything. Do not, when we say that do not learn anything new, we mean that do not depth read it. Just know what you should know about it. Like, with respect to, say, this person or canner or whatever, this person, I need to know these 5 facts. Or with respect to L-kind, I need to know Hari syndrome. Hari child syndrome, I need to know fable, I need to know audience. These 3 keywords. I do not need to know everything, how it came into picture, what he gave first, what he gave later. Not required. Do not depth read. Hmm. How to know when to stop? Like the syllabus part you mentioned. Uh, okay. How to know when to stop? Neha, basically, you will have to develop, for everyone the threshold looks different. You will have to develop where you meet the saturation, where you meet, where it convinces you that you have done enough and this feels enough. But during the last couple of days, I would say do not indulge a lot in syllabus oriented things. Just try to see whatever you know. Do you know that enough? Do you know that in depth? And any new words that you're learning, do can you read up about it and just make 3 keywords out of it? That's enough. If you know three words on it, you will have to limit yourself by knowing how much you should know, by seeing those mocks as well. Yeah, see the mocks, how they are asking about it. Mm, yes. Can first year students sit for UGC net masters? I'm not sure. I don't think they can. Yeah, I don't think you can. After only after masters, I think you can sit for UGC net. But or while in your final year, you can. But still, you eligibility is something that you will have to again check it yourself. I do not remember. I'm not a net person. Could you please share the move that you mentioned? Yeah, I will be sharing it with Shannon or Sanjana, and they will forward it to you. The ones that I used for my. Do UGC net question come in MPhil? Yes, they do. They have a good degree of overlap, about say 60 to 70% overlap. Okay, then I think you guys trust what you do know and be okay with yourself for not knowing everything. And yes, for people who don't pass, do you recommend taking a gap year? It's up to you if you want to do MPhil ahead, and if that's the way, I don't see any harm in taking a gap year. Gap year does not mean you would not be doing anything that year, right? You would be working, doing internships, or trying something as well as studying. So it's not entirely as bad, but yes, it does require a lot of your resources, demands, energy, and everything, and should invest in it only if you're willing to see yourself in if MPhil or license is that important for you. Okay. Yeah, I guess that's all. Any resource from where we can study the history of all important events, mainly asked in exams. So I think history of all important events are usually there is this Power Within Psychology book on the internet that has it that you can read it from, or as I mentioned, just go to Google Scholar and search history of psychology in India. The first few research papers that you get, read read them, okay, and highlight the keywords. Highlight the in years are not important. Sometimes they do ask it, but they are majorly not that important. But you can remember the sequence of events that happened. Not exactly date based questions unless it was a very turning point of a date or very distinct date. NIMHANS or any of these government exams are not like UGC net. You don't care when Freud was born. Okay. Yeah, I think that's all from my side. All the best, everyone. You will do great regardless, and you are already really well. Do not need a degree or an exam to prove that you are a good psychologist. Okay. Bye. Take care.